Hi, good evening. Austin Mayor Steve Adler. You got a minute? We're going to go over the numbers tonight. We also have Dr. Escott's slides, so we can look at those. We're also going to take a look at the UT dashboard. All of those things tonight to understand why it is that the three hospital systems in our city, Ascension Seton, St. David's, Baylor Scott and White, have issued a statement tonight asking, they say, quote, "We ask the public embrace a sense of urgency in following the guidelines," that the public embrace a sense of urgency. I think that's where we are right now with New Year's Eve holidays approaching. But I want you to understand why it is that such a statement would come from the hospitals today. Let's begin by taking a look at the dashboard. Again, it's me operating the controls here, so let's make sure that this is something that I can do. Let's see here. Here's our main dashboard. The number we look at is new admissions, 68. Remember, we went into red stage 5 about the time that we passed 50 conclusively. We were bouncing around 48 to 50 for a while, and then we made this jump. The 7-day moving average is 63. You can see we've gotten into the red zone here. We were bouncing down around here in the orange area, now firmly in the red area. The other number I want you to see here is the 697 new cases. That 697 number, real concerning. It's 2/3 higher than our 7-day moving average. And that 7-day moving average also reflected the 527 new cases that we had yesterday. So in the last 2 days, over 1,200 new cases in our city. The other number I want you to see, and we'll talk about that in a second, is the overall positivity at 12.7. That's what this past week is. 12.7 of the people taking tests showed up positive. Just by way of comparison, a similar number of people took tests the week before. The number was under 10. I'll show you that graph in Escott's deal in a second, but that's obviously a concerning number for us as well. But it's the 8 ICUs that is our point of greatest challenge in our city. It's not the physical ICU beds. It's the ones that the hospitals tell us from a planning perspective we can count on them being able to have available for COVID patients. They've told us 200. The 7-day moving average is 117. Let's go ahead and actually see what the numbers are tonight. So we'll go ahead and see the second dashboard that we have. Let me see if I can find that one. This is the second dashboard. Number of patients in our ICUs tonight, 138. Remember, we were just at 84 on December 21st. That's an over 60% increase in just a matter of a handful of days. We'll look at the maps and see the charts, the models. But spoiler alert, the modelers are telling us that if we can't pull down these numbers, we're going to be over 200 here within the next week and a half. That's the concern we have. In the summer, we got up to 160 total ICU beds. And I'll tell you that in the conversations I was having with our hospitals and with doctors and physicians, there was real concern, and they were getting stressed. A scenario that has us actually reaching 200 is of grave concern for us, which is why we need to do everything we can to try to pull down those numbers. Number of deaths we have in the city, 544. That's up 2 from yesterday. That's 12 people total that have passed away in the last 2 days. Number of new cases, we're at 49,648. At the rate we're going, we could pass 50,000 cases. here just in city of Austin, Travis County area. But these numbers are of great concern, especially the ICU number. The total number of hospitalized, 434. The 7-day moving average is down at 390. Number of people on ventilators, 72. 7-day moving average is 65. You know, you can find on social media some pretty compelling let me stop that. You can find some pretty compelling words from an emergency room nurse, I believe, that was on Judge Andy Brown's Facebook today, along with Dr. Escott. She also appeared. If you haven't found that on social media, you should try to find that. Just to hear somebody at the front lines talk about working with and what it's like to get this disease and to have it severely impact you, such that you're facing death, which is something that's going to happen to an increasing degree if we can't get our numbers under control. Let me show you the numbers that we also see from Dr. Escott. Let me see if I can pull up these slides in a way that gives the entire screen to the slide, so that it's easiest for you to be able to see them. I'm hoping that you can see now. This is Dr. Escott's COVID-19 update. This is his slide that shows new admissions. The yellow line is the 7-day moving average. The blue line is the actual daily number. You can see the rise that we're on in new admissions, rivaling what we saw this summer. But then looking at the positivity levels and the new cases, we're just not seeing at this point where this level's off. And that's the concern. This is the same chart that shows admissions, but here look at ICUs, a number that was staying down pretty well. You can see how the actual number is now departing pretty significantly from the 7-day moving average for ICUs. Also the same thing with respect to ventilators. This is a line that shows us what's happening by race and ethnicity. I want you to see this just by way of knowing what the numbers are. This green line is Hispanic. The blue line is white, non-Hispanic. And you can see that that line now is approaching more of what the distribution is of Latinos in our community. But I'll tell you, my concern is that as these numbers rise, we would expect to see those in our community most vulnerable to start bearing the brunt again. I mentioned that because we're going to discuss that in a slide that we have down just below, because we're seeing the early signs of positivity greatly increasing in that community. Here's positivity overall. You can see that at one point, not too long ago, we were down at 3.3, 3.9. You're trying to get below 3 is the goal. And then we've started rising as we get into the period. This is Thanksgiving in here. And then we have what you saw on the very first dashboard, 12.7 is the positivity in the community of the people that are getting tested. Of real concern for us is positivity by race and ethnicity. This line right here is Hispanic or Latino, almost up at 20% right now. 20% of folks getting tested, Latino, are coming up positive. Pretty big increase here. Black, African American, these two lines, Black, African American up above 15%. White, almost to 10%. All these numbers are high. These numbers especially high. Look at what these numbers were historically in our community. This is age group. Now remember that the age group, the state today cleared people over 65 getting the vaccine. We still are making sure that our first responders, our healthcare workers and the like are getting the tests first. But as they're getting the tests and as we have additional tests, check with your healthcare provider because they're now getting to the place where they're making the vaccine available to people over 65. I think it was something like 80% or 82% of the cases of people who die are people that are 65 or 60 and older. Those are the people we most need to protect and the people hardest to protect in our community when infectivity levels get high. People engage in activities, they figure they're not going to get it, but they end up helping to pass it to other people until eventually it gets to someone who's older, and then we have more and more people die. Look at this number right here. These are people over 80. This is positivity now. In that group of people that we test, look what the number used to be in that category. Now almost 20% positivity of people over 80. This is a real concern. Because if people over 80 are getting this virus in increasing numbers, we would expect that we're going to be dealing with an increased mortality in our city. Those were the slides from Dr. Escott I wanted you to see. He did have some recommendations for Travis County schools. I wanted you to see what those were. He is recommending that we suspend or postpone extracurricular activities within the school system when masking and distancing are not possible. That's because that's where we're seeing the clusters. It's not so much related to the classrooms as it is the extracurricular activities. Classrooms, pretty controlled, people wearing masks all the time, but extracurricular activities where people can't wear masks, can't do the social distancing, that's where we're seeing the issues. Second, in the event that activities are unable to be postponed and canceled, modify them as much as possible to reduce the risk of transmission, including proactive testing. Let's test those children more frequently so that if there is an infection, we can find it earlier before it has a chance to spread. Dr. Escott is recommending that middle schools and high schools should transition to virtual learning for 2 weeks following the winter break. That's because we're concerned about people over the winter break, over Christmas, over New Year's, being in positions where there was a little bit less discipline, being in a community with a higher positivity rate, meaning that more people are going to have it. So let's have people at home for a couple weeks so that we can find where the virus is before it spreads to more and more people. And then finally, any student or staff who traveled or participated in social gatherings outside their household during this holiday period of time when the numbers are so high, strongly encouraged to quarantine and be tested 7 days following that travel. I wanted you to see those numbers again so that you could share with us and understand why we're feeling the kind of pressure that we're feeling at this point. People are asking a comment about vaccinations. Right now, we're vaccinating the doctors and nurses, the folks in our nursing homes, nursing home patients, the people that are most vulnerable, that if they get the virus, most likely to receive complications or to face a higher risk of death. First responders, now moving to folks that are older. People over 65 will be the next group. Again, check with your healthcare provider to see when it is that it is your turn to get the vaccination. They'll be turning to essential workers, but again, focusing on essential workers that have either the higher age or a co-condition that makes them more vulnerable. But the next thing I wanted you to see here was the University of Texas modeling information. Again, I want to try and keep the slides large so that you can see the numbers as best I can present them to you. This is the University of Texas dashboard. And you can see our number has gone up to 1.39. I think it was like 1.15 the last time we looked at it. That means the virus is spreading more. Every time one person gets it, more people are being infected because of that one person. This is looking at hospital admissions. Remember when we got to 50, we said, hey, we need to start changing behaviors. This is where we went from yellow to orange. You can see the numbers have us moving up. But here's the concern. This blue aqua line is the median line. All these gray lines are possible outcomes, but there's tons more of the gray lines on top of each other in here. That aquamarine line is the median. It's probably, like what is the most likely number in hospital admissions. We can look at this same chart and you can see what happens. This is that aquamarine line you were just looking at a second ago. We could be getting up, this predicts by January 26 to 232 admissions a day. And right now we're at 68 admissions. And that is just the, we're still in January in that period of time. But as you have more hospital admissions, of course, these are the number of people actually in our hospitals. That number goes high. But look at ICUs here. This shows you the ICU numbers that we've been taking a look at. This is the number we were looking at. We were at 84 on December 21st. That's 8 days ago. We've seen this number rise. And today we're at 136 was the number here. And this is what this line looks like. Remember, we only have 200. The hospitals tell us from a staffing standpoint, from a planning standpoint, they tell us that from a planning standpoint, we can handle, as we normally would, 200 COVID patients. But the 200 line, let's change the scale on this. This is the 200 line right here. You can see at the current rate we're on, we passed 200 here at about January 6th. Past January 6th, we don't have from the kind of staffed ICU beds. But look at the incline that we're going to be on at that point. I mean, it's hard to even imagine what's happening in our city if we get up to 494 ICU COVID patients by January 25th. Now, we're not at this place right now. But just as the hospital said, now is the time for the public to embrace a sense of urgency, because we have to change the conditions. If we continued at the same rate we're going, this is where we will be. And that's why we need everybody to mask. Anytime you leave the house and you're around other people, mask. Don't be outside around other people without your mask on. Social distance. Avoid large groups. Wash your hands, and do that kind of hygiene. This is crunch time. I would urge everybody to go take a look at the social media from the from Judge Brown's Facebook with Dr. Escott this morning to hear from that emergency room nurse. For this reason, and with New Year's Eve approaching, the health officials asked Judge Brown and me to do everything we could to limit activity on New Year's Eve night, Thursday night, Friday night, and Saturday night, in those situations where people are close to one another and not wearing masks. As you know, our orders in this city pretty much have everybody wearing masks everywhere. The exception to that is restaurants. There are a lot of restaurants that are doing really well with discipline. Everybody's sitting at a table. People are distanced. Everyone's wearing masks. But we also have restaurants that used to be known as bars, but under the governor's exception are now treated as restaurants. And we have too many people too close to each other in these restaurant situations without their masks on. And that is just an event that if it goes south on us in the evenings, late at night, on New Year's Eve, on Thursday night, Friday night, and Saturday night this week, could absolutely turn our system upside down. And the concern, of course, is if that happens, it's not the people who are at the restaurant or the bar that are going to be paying the price for that. If we have lots of people that end up in our ICUs because of that, the people that will pay the price will be the other people that need that ICU space. It'll be the other people that get COVID. It'll be someone who has a heart attack or is in a car accident. So the Judge, Brown, and I entered identical orders today that concern activity in restaurants after 10:30 on Thursday night, Friday night, and Saturday night. And what we're saying is that, consistent with what Dr. Escott has asked us to do, that the order reads, because the wearing of face coverings and physical distancing is not possible when individuals are seated together and dining, thereby increasing the risk of spreading COVID-19, a business must end indoor and outdoor dine-in food and beverage service at 10:30 p.m., but may continue to operate after 10:30 p.m. using drive-in, curbside, takeout, and delivery service. But there will be no dine-in food and beverage service at restaurants or bars, no food or beverage after 10:30 and before 6 a.m. the next morning. So from 10:30 to 6 a.m., you can do carryout, you can do delivery. We should all be doing those things to support our restaurants and as best we can during this period of time. And I know that this is a huge impact on those restaurants. We also know that there may be people that were planning on being out late between 10:30 and midnight or 10:30 and 1 on New Year's Eve or this weekend. But when you take a look at the numbers I just showed you, with the possibility that if we can't change the trajectory, not only do we cross 200 ICUs, which is what we have been told by the hospitals to plan on being what they can handle as in normal circumstances, that number could get as close to 500 before we're out of the month of January. We recognize this is a huge imposition with huge cost. But as we have said from the very beginning, we're going to be following the science and the data and doing everything we can in this community to save as many lives as we can. That order is posted for people to see. I just read you the operative section. Please not only concern yourself with the health, mask, social distance. If you go out of your home and you're around other people, you wear a mask everywhere. Social distance. We have to change this trajectory. And then support the restaurants. Let them cook. They do takeout, do delivery. Over tip your wait staff. Let's do everything we can to try to mitigate the impact that we're seeing as best it is that we can. Wish the news was better. Let's get together again tomorrow night in a quicker fashion. We'll be able to go over the numbers and you can see what's happening in the city. If we started changing behaviors effectively when we started making this real call for it just prior to Christmas, hopefully we'll start seeing that impact here shortly. We just don't know. You all take care of yourselves and be safe. Good night. And remember, as our hospital systems are saying, now is the time that we ask the public to embrace a real sense of urgency. Good night.